This evidence-based proposal is designed to address the issue of communication, specifically as it applies to female patients' abilities to accurately communicate symptoms of thyroiditis. Given the close similarities of thyroiditis with other disease processes, thyroiditis is often labeled as chronic fatigue syndrome, depression, and arthritis, just to name a few. It is these similarities that are often resulting in an inaccurate diagnosis and hence a delay in treatment. The ability to communicate plays a significant role in making an accurate diagnosis. To implement change in this internal medicine clinic, a decision tree will be utilized to identify female patients with symptoms indicative of thyroiditis. The decision tree is not intended to diagnose, but to merely facilitate the patient in communicating symptoms they experience. Patients must be empowered to recognize and report symptoms of thyroiditis to their providers to enable and acquire appropriate and effective treatment. This evidence-based proposal will serve to facilitate proactive change for female patients communicating the symptoms of thyroiditis to healthcare providers. Hello everyone, I'm Tamara Lynn Thomas. I'm a registered nurse. I'm a 1994 graduate of William Carey University in Hattiesburg, Mississippi. Hi Dr. Lycan and classmates. I also want to thank all the other nursing educators who have taken time to listen and view this evidence-based proposal. My degree track here at Kaplan University is the Family Nurse Practitioner Program. My clinical practicum site is located in Columbia, Mississippi, which is approximately 30 miles west of Hattiesburg, Mississippi. The clinic is known as Internal Medicine Clinic of Columbia. It is a privately owned clinic staffed by one physician and two nurse practitioners, one of which is my preceptor, Carla Whitfield. My preceptor, who is a native to the community, is passionate about her role as a healthcare provider. She is a patient advocate as well as an educator. Carla is a graduate of the Mississippi University for Women and received her undergraduate degree from the University of Southern Mississippi in Hattiesburg. I feel privileged to be precepted by a nurse practitioner who places so much emphasis on health promotion, maintenance, and education. This evidence-based proposal that I am proposed today looks to facilitate a proactive change for female patients communicating the symptoms of thyroiditis to their healthcare providers. Clinical excellence. Though hysteria is no longer a legitimate diagnosis, there are others that are now attributed to women who complain of seemingly vague and/or unrelated symptoms, such as arthralgias, brain fog, and decreased libido. Symptoms are often dismissed as chronic fatigue, depression, or menopause. Communication deficits leads to inaccurate diagnosis. Patients must be empowered to recognize and report symptoms of thyroiditis to their providers to enable and acquire appropriate and effective treatment. The problem identified in this evidence-based proposal is evaluation of symptoms reported in women with complaints of brain fog, fatigue, and myalgia may lead to an inaccurate diagnosis when in actuality thyroiditis goes undiagnosed and treated. The purpose of this evidence-based proposal serves to facilitate a proactive change for female patients when communicating the symptoms of thyroiditis to their healthcare providers. This evidence-based proposal involves integrating a change to the routine of practice. A brief synopsis of the review of literature. The literature indicates a problem exists with patients when communicating their symptoms. Effective communication facilitates healthcare providers in making an accurate diagnosis and management. Competent communication consists of organizing, prioritizing, presenting clear and concise symptoms. The model for evidence-based practice change looks at assessing the need for change, locating the best evidence, analyzing the evidence, designing a practice change, implementing and evaluating a change in practice, and then integrating and maintaining that change in practice. Communication is a central component to the core of diagnosing a patient. As it relates to my evidence-based proposal, a problem in communicating symptoms was identified as it relates to thyroiditis. Because symptoms often mimic other disease processes, the use of this framework and the decision tree designed to identify and communicate symptoms of thyroiditis, an accurate diagnosis and plan of care will ensue. Posted here is a picture of the decision tree that I designed for patients to review. The decision tree guides the patient through a series of responses that may be indicative of thyroiditis. The intent is not to diagnose but to facilitate the patient in communicating symptoms. If the patient responds yes along the tree, further evaluation is required by the provider. The tree asks questions such as, I'm exercising and I'm eating healthy, but I'm still gaining weight. Other responses on the tree are, I feel sad, moody, or depressed. I have problems with constipation. Do you have a family history of thyroid problems? Did you have thyroid problems at pregnancy, but then they went away after pregnancy? Any of these responses that the patient may have a yes to will, as I previously said, indicate further evaluation by the healthcare provider. Larrabee indicates a practice change is more likely to be implemented if it entails 5 important attributes. These attributes are relative advantage, observable benefits, simplicity, augmented support for technology, and innovation. In reference to a relative advantage, the proposed change in practice is cost effective to implement. Even with salary costs and supplies to implement this change is under $300. The patient benefits because bearers and communicating symptoms are diminished with the use of the decision tree. Likewise, healthcare providers benefit from reviewing the decision tree. Time is better utilized because the decision tree has already addressed many questions that the healthcare provider would have asked, and the patients have already responded. The tool is simple, easy to read and understand. The attribute of technology is not a factor in this evidence-based proposal. In order to implement this proposal, copies of the decision tree will be printed and placed at the front desk for inclusion in female patients' initial paperwork. Established patients will be provided the decision tree to assess their potential symptoms of thyroiditis on their next appointments. Also important if deciding if an evidence-based proposal will be implemented is the fit of this change in an organization. In reference to this proposal, the fit of this change, of this recommended change, fits nicely within this organization and no conflicts are foreseen. This proposal was designed to be implemented at a privately owned internal medicine clinic that is staffed by an internal medicine physician and 2 nurse practitioners. The estimated time to implement is 2 weeks. Prior to implementing this evidence-based proposal, a brief 15 to 20 minute in-service will be provided to educate the clerical staff and nursing staff on their role in implementing the use of this decision tree in practice. Approximately 2 weeks after the initial implementation, a second assembly of the clerical and nursing staff will be held to allow an opportunity to address any questions or concerns. In consideration of a timeline to determine the effectiveness, Larrabee stipulates 4 weeks is considered sufficient time to determine the effectiveness. After 4 weeks, a brief meeting will be held to discuss any proposed needed changes. The role of the family nurse practitioner. This image I have in the upper right hand corner indicates I'm a family nurse practitioner. What's your superpower? Well, I'm still waiting for those superpowers to kick in, but as it is, nurse practitioners are active in the role of health promotion, wellness, and screenings. They are change champions. They engage in research, advocacy, and education. They collaborate with specialties when needed. They are providers in healthcare in various settings, including ICU, ortho, neuro, nephro. They order and interpret laboratory tests and diagnostic studies, and they also utilize prescriptive authority to treat and manage illness and disease processes. They also have autonomy in clinical decision making. The role of a nurse practitioner is very diverse. Because this role is so diverse, there are numerous employment opportunities available. Evaluations of this practice change will look to establish the efficacy of the change in which female patients communicate their symptoms of thyroiditis to their healthcare providers. A Likert-type survey tool will be used to measure patients, healthcare providers, and staff members' responses. Responses from each category will be reviewed and appropriate changes will be made. As we have addressed the final discussion, we want to look at the significance of evidence-based nursing practice on the role of advancement and utilization of nursing knowledge, family nurse practitioners, and change agent. According to Larrabee, evidence-based practice is quickly becoming the goal of nursing. The utilization of evidence-based practice models have facilitated in making evidence-based practice changes. These changes require a systematic and strategic plan in order to implement them. The family nurse practitioner is impacted by evidence-based practice change when clinical guidelines improve patient outcomes. Implementing evidence-based nursing practice in a practice instills a sense of autonomy. This autonomy is felt when utilizing clinical experience and implementing the best clinical guidelines for the best possible outcome for your patient. The nurse practitioner also fulfills the role as a change agent when implementing a practice change. This role is one that practitioners are well trained for. Given the other hats this profession allows us to wear, roles such as advocates, educators, health promoters, and care providers, they all help to define the term change agent. It is these roles that make nursing the obvious change champion when it comes to promoting a change in practice or implementing a new practice. As I have approached the end of my presentation, I want to extend an invitation for questions at this time. I also want to take this opportunity to thank God. At times I felt so overwhelmed. I would tell myself, God did not bring me this far to see me quit or fail. And then I would push on. I also want to thank Dr. Likert and Dr. Mason for your guidance and patience. And to my classmates, I have enjoyed this interaction, feedback, and guidance you have provided. This last class was one that I terribly feared. Dr. Mason and Dr. Likert provided positive, non-punitive feedback with encouraging words and explanations. My immediate plans upon graduation are to submit the appropriate paperwork to the Mississippi State Board of Nursing and to the American Academy of Nurse Practitioners to sit for my certification as a nurse practitioner. I also will be studying and preparing for this certification, which will be such a major milestone in my life. My future plans for employment are still up in the air. I do not want to put the cart before the horse, so to speak. I plan to wait until I get my certification before I actively start looking for a job as a nurse practitioner. If anyone would like copies of this presentation, I can be contacted at tamra_thomas30@yahoo.com. My contact phone number is 985-516-3085. And again, I'd like to thank you for your attentiveness as I have presented this evidence-based proposal on communication and thyroiditis. Thank you.